Hi, I'm Colin Rock, Head of Partnership Development here at Black Health Matters. And we're going to discuss a very, very serious topic, advocating for a healthy and respectful birthing experience. This presentation is sponsored by healthforequity.org. We're going to discuss an educational experience about the nuances of the Black birthing conversation and how to work towards a safe birth for both mother and baby. Our moderator for today is our own Darla Miles. Darla has been our Emmy Award-winning reporter for WABC TV since 2009. In addition, Darla volunteers often as a moderator and public speaker, serving as an MC for countless community award ceremonies and civic events within the tri-state area. Honored by the National Coalition of 100 Black Women for Community Service, and as a member of Links Incorporated, Darla has been instrumental in implementing programs for at-risk youth, children in foster care, and homebound seniors in her community. I want to thank all of the participants for their willingness to join Black Health Matters and the sponsor of this extremely pertinent session, healthforequity.org. Healthforequity.org, health, the number 4, equity.org, calls for planning and advocating for the birth you want, with help from a certified community-based birthing doula. Thank you again, ladies, for joining us today. Darla Miles, thank you so very much for moderating this important panel.
Colin, thank you so much for that introduction. And I'd like to welcome everyone who is joining us virtually for investing time in your Saturday morning to talk about such a high impact, important topic as a part of the Spring Summit for Black Health Matters. It is welcome to the advocating for a healthy and respectful birthing experience. That is what we're going to be talking about today, advocating for a healthy and respectful birthing experience. With the onset of COVID-19 in 2020, it definitely elevated the dialogue with regard to health disparities, and that gave voice to Black maternal health, which has always been of concern, but now it's part of the mainstream dialogue, the higher rate of death from Black women during childbirth. I have to forgive me, I was just pulling up my stats from the CDC because as a reporter, I like to have all of my stats available, but I have done extensive reporting on this for WABC, so we don't have a lot of time. I want to get right to our panelists for today. First, I'd like to introduce Dr. Shanna Cox. She is the Associate Director for Science, the Division of Reproductive Health for the CDC. And she has published extensively on a wide range of topics, including maternal and infant health, chronic disease prevention and management among persons of reproductive age, contraception access, substance use, and the evaluation of programs and policies. She is an agency expert in health equity, which is the foundation for this Spring Summit. And she will be sharing her wisdom and expertise shortly. Secondly, I'd like to introduce another panelist today, another distinguished panelist. This is Dr. Barnes, Dr. Kamila Barnes. She has been an RN for 14 plus years and is currently an assistant professor of nursing at Long Island University in Brooklyn and a clinician at Northwell Health. Now, she's also the founder and owner of Barnes Health Affiliates, which is a multifaceted healthcare support services company dedicated to educating healthcare lenders, informing best practices, and elevating standards of care within community. Without further ado, I'd like to toss it over to Dr. Shanna Cox with her presentation. I believe you have some slides for us today.
Yes, Darla, let me try to share my screen. Can you guys see my screen okay?
We got you.
All right. So good Saturday morning. Thank you for this introduction. And today I'm going to talk briefly about COVID-19 and Black maternal health and some of the ways we can work together to help Black women achieve optimal maternal health. So we know that Black persons are disproportionately at risk for COVID infection, and we need to acknowledge the drivers of this increased risk, including lack of access to quality health care, disproportionate representation among essential workers, such as public transportation, which require frequent or close contact with the public, and lack of benefits such as paid sick days. Specific to pregnancy, COVID infection during pregnancy results in increased risk for severe illness for pregnant and recently pregnant persons compared to non-pregnant persons. Pregnant persons with COVID are at increased risk of preterm delivery and stillbirth, and might also be at risk for other poor pregnancy complications. So getting a COVID-19 vaccine is an important step to help prevent getting sick from COVID-19. Evidence continues to build showing that COVID-19 vaccination during pregnancy is both safe and effective. But as I was preparing this talk, I remembered Henrietta Lacks. Her story in the New York Times bestselling book is one of the possible reasons that for some people, they do not have confidence in vaccines. So for those who may not know the story, in 1951, Mrs. Lacks was 31 years old and a mother of 5. She was diagnosed with the cancer of the cervix, which was incredibly aggressive, and she passed away around a year after her younger son was born. Her cancer cells were found to be the first and only immortal cell line in culture. They came to become known as the HeLa cells, a cell line that has been used for traditional vaccine development for decades. But the true tragedy is that she never provided consent for her cells to be used, and neither she nor her family members received the benefit or acknowledgement of her contributions to science and the public until this book was written. She gave us an amazing gift, and we now know her impact. Her story and others, including the Tuskegee syphilis studies, forced sterilization of Black and Brown women, are examples of why Black and Brown communities may mistrust the medical and public health institutions. And so if we really want to stop COVID-19 and disproportionately impacted populations, we have to openly discuss the issues that drive inequities. And as mentioned by Darla, disparities in maternal health for Black women have existed across the lifespan, existed across generations. And even though the disparities may have gotten more attention with COVID-19, we must acknowledge they've existed for a long time. And while we've seen improvements over time, there are significant disparities in preterm births, teen births, and chronic conditions. We also see, as mentioned, maternal mortality. American Indian, Alaska Native, and Black women are 2 to 3 times more likely to die of pregnancy-related causes than white women. These disparities increase by age and are present at all education levels. It is time that we listen to these communities to provide the care and social support they need to improve their health and the health of their communities. So as I close, one of the CDC efforts I really wanted to highlight to address disparities and improve outcomes for mothers is the Hear Her campaign. The goal of the campaign is to raise awareness of potentially life-threatening warning signs during and after pregnancy and improve communication between patients and their healthcare providers. The site features a range of information for pregnant people, their support networks, and healthcare professionals. I would encourage all of you to go view the PSAs and testimonials on the site if you haven't already, because they are quite powerful. These materials are really designed to drive home the messages of empowering women that they know their bodies best and speaking up to get the help that they need. It provides materials for support networks on how they can help and healthcare professionals to listen, ask the right questions, and provide timely, respectful care. Materials include posters, palm cards, shareable digital and print graphics, and a social media toolkit. We're continuously collecting stories, partnering with influencers, and one of our featured stories is Olympic track and field star Allison Felix. So if you're interested in learning more or getting involved, please reach out to contact the Division of Reproductive Health at hearher@cdc.gov. I also want to briefly mention that we have ongoing work to develop a segment of the campaign specifically to reach American Indian and Alaska Native women. We've conducted focus groups, received input from tribal leaders and others in the community, and we're in the process of recruiting people to share their firsthand stories to feature in the campaign. And we're hoping to launch materials for this segment this summer. So those are all the slides I have, and thank you again for having me today, and I will pass it on to the next speaker.
Thank you very much, Dr. Cox, for kind of laying the groundwork for this conversation today. I do want to encourage everyone who is in attendance today, who's watching. We do have a Q&A box that you can enter your questions. So if you hear something while our speakers are making remarks, please, I encourage you to go ahead and start to formulate your comments and questions now so that we can try to get to as many of them by the end of this webinar. I did pull up in my extensive array of notes over here the number that I was looking for, because we know that Black women are 3 times more likely to die than white women, but I wanted to find the CDC metric that really honed in on that, where that data is based on. And basically, the pregnancy mortality rate among Black women is 55 per 100,000 live births. So every time 100,000 births occur, you have 55 Black women who were dying. So that's kind of like resonates a little bit more than just saying how more likely Black women are to die. And that's why I want to turn it over to Dr. Barnes right now, because she has done extensive advocacy in this space. And so Dr. Barnes, what insight can you share with us about these really challenging metrics and your advocacy to turn that around?
Thank you, Darla. So I'm glad you pointed that out about 55.3 per 100,000, because the numbers are actually higher in certain states. And also the disparities are higher in certain communities, up to 12 times more likely, right? And so we're not only talking about mortality, we're talking about near-death experiences. We're talking about complications that have long-term implications and morbidity of disease. So how do we tackle this? So I've been an advocate for over a decade, and through my LLC work, I've taken the opportunity to educate the public and bring awareness, whether it's my colleagues, whether it's the public, but also through my organizations such as Greater New York City Black Nurses Association. We've been very politically active. It's important for people to understand that this issue has to be tackled from different angles. Right? Social determinants of health is exactly what it says, social determinants of health, but there's also political determinants of health, right? So how our communities are structured, our economic disadvantages that we experiences. And so all of these factors contribute to poor health outcomes. We know that 78% of deaths were preventable in 2018 in New York State. How do we know that? It's because our political leaders supported the formation of maternal mortality, committees to review these deaths and to bring up recommendations and form an advisory council to interpret these findings and make recommendations, right? So think about that for a minute. 78% of deaths were preventable in 2018 here in New York. So we have to do better, but it has to be a collaborative effort. So community-based organizations have a lot of power. Healthcare professionals have a lot of power. And how do you utilize your power is by definitely having a relationship with your political leaders and your top officials and saying that this is an issue that needs to be urgently addressed. And we need political support. We need the Omnibus Act to be passed. We need new policies. We need to reduce barriers to care, the restrictions on scope of practices that create barriers to care for, especially in communities that are underserved. We need funding, money to support new health initiatives, birthing initiatives. We also need support from our healthcare community to create safety bundles, right, to address the common causes of death, like hemorrhaging, preeclampsia, and also addressing mental health issues that can contribute to death as well. So it needs to be a partnership. So it's really important that policies are created to improve healthcare outcomes, both in the hospital setting, but also at the local, state, and national levels that reduce barriers to care, improve, mitigate the factors that contribute to health disparities, and also there needs to be more attention to this, right? So we have to take ownership of our issues and really put it in the forefront, because this has been going on for a very long time. And unfortunately, it's getting worse. The 55.3 is a worse statistic, as of that was as of 2020. So as an industrialized nation, we have one of the worst birth outcomes and pregnancy care in comparison to other industrialized nations. So a lot of efforts, coordinated efforts between community-based organizations and advocacy needs to happen in order to change this. And that's something that our chapter has been doing as well. We meet with our legislators every year. We get updates on what's going on and bills that are being passed at the state level and at the national level. We keep having this dialogue, so we don't just protest and go home. We keep having the dialogue about it. We've been putting on conferences and including our community members, people affected by, had issues during prenatal care or in the postpartum period, or lost family members. And we also bring awareness. But the most important thing is that at the state level, it has to be a priority. And in New York State, thankfully, they have formed a maternal mortality review board and an advisory council. And they have worked together and recently published a report, including recommendations to improve this aspects of care for prenatal and postpartum, but also improving training, right? Trainings for offering funding for training for providers to reduce implicit bias, to address racism in the healthcare system, also providing support for doula support care, for funding for that. And that's what our mayor in the city is promising to do, is to enhance doula support services for areas that have really high mortality rates. And also the report provides other recommendations for improving outcomes, such as safety care bundles in the hospitals, so that if a mother has symptoms, they can act quickly and intervene and save their life, and also reduce complications. So again, resources in the community is really important. We know that nutrition is an issue, food famines, food insecurity is an issue, and food really predicts health outcomes as well. So there's a lot, again, this is a multi-pronged approach to addressing this problem. Thank
Great.
you.
So you kind of touched on a lot of things, a lot of the different avenues where this is being addressed. And I want to really drill down on a few of those right now. But I know that we still have to get to Miss Ali, and this is a 30-minute panel. So this is such a broad, expansive topic, but I'm going to try to get to as much of this as I can with the two of our wonderful experts today. The first thing I want to point out is you mentioned the rates are higher geographically. I want to point out that here in the city of New York, we have 33 neighborhoods in the Bronx, Staten Island, and Brooklyn who have higher Black maternal health morbidity rates, which is one of the initiatives for the doula and midwifery program that was announced by Mayor Adams last week. And we're going to definitely touch on that. That's based on some great work that has been done at the Brownsville Action Center. But in terms of political activism and legislation, back in February, Jumaane Williams introduced a comprehensive maternal health care legislation package here for the City Council of New York. And I want to ask Dr. Cox, what are we seeing on the advocacy front nationwide? Are we seeing similar initiatives like what Mayor Adams here is introducing with the midwifery and the doula program, as well as the comprehensive Black health legislation package introduced by public advocate Jumaane Williams? Do we see other cities taking the lead on this as well, or following suit?
Yeah, I mean, I think as Dr. Barnes mentioned, maternal mortality review committees are really the way to dig into the data and identify opportunities for prevention. So we really see a lot of these community-based organizations and advocacy groups taking that information and passing legislation, for example, around extending postpartum coverage for the full year during pregnancy, ensuring that mapping out mental health providers and things of that nature, reimbursement through Medicaid for doulas. Really, again, looking at scope of practice laws. We know for rural communities, American Indian, Alaska Native communities, those things are very important. So I think there's a lot of movement both at the national, state, and local level where people are really kind of marching at the door with the data in hand and showing what works to prevent maternal deaths.
Great. So we have our first question, and I want to open it up to both panelists. We have a question that says, does healthy nutrition play a part in the high Black maternal mortality rate? That is a big question because a lot of people want to know, is it my nutrition, or is it because I'm not taken seriously because Black women across the board, across socioeconomic barriers, are not taken, received as well by physicians? We have data with regards to that. Is it genetic? So talk to us about nutrition and the Black maternal health mortality rate. Thank you for this question.
No, that's a great question. Nutrition is so important. I mean, it predicts, people are so accustomed to diabetes existing, but if you look back in time, there was a time that diabetes did not exist, right? I've presented about Native American Indian tribes where diabetes didn't exist at some point, but when they were introduced to Americanized food, right, and their agriculture was lost because they were displaced, all of a sudden diabetes cases developed, right? So we know that in many underserved Black communities that food famine is an issue, or access to fresh foods, or even also education about healthy items as well is lacking. And so when you have poor nutrition, it can increase your risk of high blood pressure, of diabetes, and also other health problems. So when you have these health issues during pregnancy, it's a cascade, it's a domino effect. And now you're in a predicament where you are high risk, right? So we know that food, and that definitely needs to be addressed as well. And that's why I said social determinants of health, that is one of the determinants of health, is nutrition in the communities.
So we've talked about a lot of things, and obviously, again, we can't boil everything down in one 30-minute session, but what is the most important advice do you give Black women listening on this call to advocate for themselves in terms of maternal health? What can they do?
Well, again, I think that was the onus for our communication campaign and the different facets of the campaign, really knowing, with Black women, we know our bodies and we know when something is wrong. So really listen, as a community, as healthcare providers, we have a responsibility to Black women to hear them. It's one thing to speak up and empower women. It's one thing to make sure that we have equitable, respectful care. Addressing the social determinants and the political determinants of health is also important because that's the social context in which persons are birthing within. So there's not one magic bullet. It really is thinking about what are all the things that encompass the experience of Black and Brown birthing persons, and how do we really listen to what their needs are and provide the respectful care to women in the communities that they reside.
So we have another question in the chat for Dr. Barnes. We have an attendee who would like to know how nurses can get involved with BNA and the initiatives that you've mentioned. And also, what tips do you have for nurses who want to advocate on a larger scale but don't know where to start?
First, I first say we would love to have more nurses who are passionate. We have a maternal health committee in our chapter, and our website is www.gnycbna, as right above my head, .org. And there's a join us tab that goes directly to our email membership if you're interested in joining, and we will respond and tell you the next steps. As far as advocacy, number one, get involved with like-minded people. So if you join our chapter or even another organization that focuses on this, get your group together, meet with, schedule appointments with your legislators, know who your politicians are, get together with like-minded individuals in the healthcare field, have conferences, have, educational forums, because also through the activism work, you also meet other people, right? Who you may not think that you would meet. And then you realize that you're all doing the same thing. So collaborative efforts in our community equals power. And we are nurses in general, we're 4 million strong in the United States. Imagine if all of us were advocating for different health issues, even if it's not this health issue, something else. Imagine if we came together and really advocated and also really supported. So outside of patient care, we are there in the community and boots on the ground. So that's my advice.
All right, great. We have about 6 minutes left, and I'm still going to pack in as much information as I can in this last 6 minutes. I want to go to Dr. Cox and kind of maybe pull the lens out just a little bit. With the CDC in your Black Maternal Health Initiative and all of the data that you've been collecting since data started being collected on this issue, can you explain and really expound upon why Black women, when it comes to not just their maternal health, but their health, they are not taken as seriously as other races? What data can you share with us regarding that, and what have been your findings in your studies? Because I think if we kind of lay out what the root cause is, that may also help answer the question that's been posed, what Black women can do to advocate for themselves.
Yeah, that's a great question. I mean, I think it comes down to acknowledging implicit bias and institutional racism and how that plays a role in the care that persons receive. So, for example, there have been many examples of Black persons with sickle cell not receiving adequate pain medication, or Black persons with heart disease not receiving the same tests as their white counterparts when they arrive. So this, again, is not something that's specific to Black maternal health, but something that's ingrained in our mindset and our culture of healthcare delivery around Black persons not receiving the same and equitable and less quality care than their white counterparts. So I think there is an opportunity, for healthcare systems to really start measuring that information. Are persons receiving the same care? If you're measuring quality metrics that are presented to the Joint Commission and other bodies, really making sure that we're disaggregating that data to make sure that we can show where there are disparities and how we can, close that gap in the receipt of care. Again, I've mentioned respectful care a number of times. There are examples of persons who we have data that show that persons who have experience of discrimination are less likely to return to prenatal care, that Black and Hispanic persons are more likely to report disrespectful care. And sometimes when you're providing care to a person, it may be something as simple as saying a patient is non-compliant or not showing up for appointments, but we really have to, again, talk to our patients and listen to our patients, because it may be that person didn't have childcare or that person didn't have a ride. So what's being documented as a non-compliant patient is, again, care that's being driven by those social determinants of health.
Okay, so 2 minutes left. I have one question and I do want to wrap. But if we can, Dr. Barnes, in 1 minute or 1.5, 1.5, what, 1.5, in TV we call it 1.5, but 90 seconds. Midwifery and the doula program. I know that Mayor Eric Adams is going to be training at least 50 more midwives in the next 3 months. They're expanding the implicit bias training. Culturally, why are midwives and doulas important to Black women and advocating for their own maternal health? I love, big question, not a lot of time, but I know you can take
that
it.
is a big question, because that goes way back in history to when midwives would take care of our ancestors, right? And were the caretakers, because Black women were not allowed in hospitals, right? We remember those times, right, historically. And so over time, midwives, certified nurse midwives, are fully trained to deliver babies, and they have a good record of delivering babies safely. Certified nurse midwives, I'm glad you brought that up, because there's a current bill in New York State that is a community midwifery bill. So if that gets passed, that expands access to midwives. And midwives will help to also fill in the gaps in care in these communities because spatially, some communities have limited access to care, right? We also know that doulas provide a bunch of support. It's not just birthing. They provide psychosocial support. They provide services, other services and parenting, like teaching about parenting, what to expect, and also mitigating stress. I can't stress this enough that mitigating stress is going to help with safer birth outcomes, reducing that blood pressure, reducing that other outcomes that are associated with stress. So certified nurse midwives are great, and hopefully we'll get birthing centers in the Bronx where we can be staffed by various health birth workers and also doula support services. So I try to say that in a minute.
You did. You did. So, okay. So with that, I do want to, as we wrap, unfortunately, Miss Ali was not able to join us, but I want to encourage everyone who is within the sound of my voice to read her 2019 article in Essence magazine, her essay called Birthright. She really describes what she herself described as a very demeaning, humiliating, traumatizing experience that almost that it did impact the health of the birth of her first son. And that's why she's been such a fierce Black maternal health advocate. That article will empower you. It will empower you to know that this is an issue that transcends socioeconomic levels. And that's the first step, is just finding your voice and knowing it's okay to challenge or ask additional questions. I know that you can find more information on this at blackhealthmatters.com, as well as you can make sure you find Dr. Shanna Cox. Do you have an Instagram or a Facebook or a Twitter, a handle that you would like to share in closing where people might be able to ask you further questions?
No, I do not, but I will go ahead and drop in the chat, hearher.com, that's where we want folks to, again, join us, tweet with us, share with us, and really get those messages out. Thank you.
All right, great. And Dr. Barnes, anything else that you would like to share with regard to anyone following up with you on advocacy, if they want to contribute or if they have any other questions beyond this panel?
Yeah, so I'm going to drop my IG in the chat. It's BHA_LOC, and you can follow me on Instagram and also direct message me. And also, if you want to do a presentation with my LLC or get involved with me for advocacy work, I welcome all of that. We have a long ways to go, but we can do this together.
Great. Thank you again for your time this morning, Dr. Barnes, Dr. Cox. Make sure you read that 2019 article in Essence by Tatiana Ali called Birthright. And thank you for joining us for our high impact webinar today, advocating for a healthy and respectful birthing experience. Please enjoy the rest of your day here at the Black Health Matters Spring Summit.
Thank you.